Counselor Felch indicated
He is not in tonight and not remote.
he's in Vermont. Good evening, the hour being 7 PM on Monday, September 9th, 2024. I'd like to call to order the City of Laconia City Council meeting. Before we go any further, though, I'd ask you all to join me in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Joined this evening by City Clerk and Tax Collector Katie Gargano. She's also our recording secretary, and I'd ask her to please call the roll.
Counselor Cheney,
Here.
Counselor Susie,
Here.
Counselor Hoffman,
Present.
Counselor Haynes,
Here.
Counselor Bogart,
Here.
Mayor Hosmer.
Present. Counselor Felch is absent with previous notice to us. We're also joined at council tables tonight by Kirk Beatty, the Laconia City Manager, and Glenn Smith, our Finance Director. There is one issue that's been just brought to my attention, which is agenda item number 22D. May move that up right now, if you don't mind, because my recommendation to the council, I know we have someone in the audience, people in the audience, my recommendation to council that this issue should probably get a separate public hearing. The city will be selling surplus land at significantly less than appraised value. As you can see from our packet materials here, the city has a written offer by the owners of the abutting property, 42 Woodland Avenue, to purchase the land for $10,000. An appraisal of the property has been completed and has an opinion of value at $60,000. So I think before we short sell the property, based on that opinion, an opinion alone, that this should move to a public hearing and allow the public to have an opportunity to not only know about it, but speak to it.
I'll move that.
Thank you. So moved by Counselor Susie, second by Counselor Cheney. Is there any further discussion? Seeing none, all those in favor, please indicate by raising your hands. That's 5 votes in the affirmative. That motion passes. That'll be on the next City Council agenda for the 23rd. Thank you. For public hearing. And there may be, it'll go on unfinished business, so the city may do something a little later on in the hearing under unfinished business on that. Moving along to agenda item number 7, which is acceptance of minutes from previous meetings. Agenda item number 7A. These are the minutes of the regular city council meeting of August 26, 2024. Minutes of that meeting were distributed to the members of the city council on September 6th, 2024. With no corrections or changes submitted to the clerk, the minutes will be accepted as distributed. Consent and action items, agenda 8A, which are recommendations for appointments to the boards and the commissions. The appointment subcommittee met on August 13th and 20th and interviewed candidates for appointment or reappointment to the city's boards and commissions. At the August 26, 2024 meeting, the city council voted to table this item so each council member would have an opportunity to review the applications of all of the people who had applied for appointment or reappointment. The following individuals are strongly recommended by the appointment subcommittee for appointment or reappointment, and that appointment subcommittee is made up of Counselor Susie. Who else? Counselor Cheney. Counselor Haynes. I can go through them right now. Russ Porio, reappointment to the Weirs TIF District Advisory Board. Richard McNeil, appointment as Commissioner on the Lakes Region Planning Commission. John Paula, appointment to the Weirs TIF District Advisory Board. Gail Ober, reappointment to the Planning Board. Kristen Bastille, appointment to the Planning Board. Robert Ames, reappointment to the Weirs TIF District Advisory Board. And Dave Ouellette, appointment to the Planning Board. So right now, I'll be looking to take this, I've suggested that this be taken off the table, and who'd like to make that motion? So made by Counselor Cheney, seconded by Counselor Susie, and that's non-debatable, so I'd ask the clerk to call the roll.
Counselor Cheney?
Yes.
Counselor Susie?
Yes.
Counselor Hoffman?
Yes.
Counselor Haynes?
Yes.
Counselor Bogart?
Yes.
5 votes to the affirmative, and that motion passes. Right now, I'll be looking for a motion to move to approve the appointment or reappointment of candidates to the city's boards and commissions as presented and as recommended by the Appointment Subcommittee. So made by Counselor Susie, seconded by Counselor Cheney. Is there any further discussion on the motion? Seeing none, all those in favor, please indicate by raising your hands. 6 votes in the affirmative, and that motion passes. Moving on to agenda item number 9. This is citizens' comments for matters not on the agenda. If anyone is here tonight who would like to speak to matters not on the agenda, now would be the appropriate time. Welcome.
Thank you very much, sir. Anthony Santagate, Tower Hill Tavern, Big House, and the Fancy now. And I'm gonna open up a haunted house for Halloween at the Tower Hill Tavern on both floors, with permission from the fire department, hopefully. And really, that's it. I think it'll be good. It'll be the biggest heated haunted house in Laconia.
What are the dates you're looking for, Anthony?
Probably the weekends, last 2 weekends of the month. Maybe even the last whole week, I think. Oh, you wanna do every weekend? Every weekend in the month of October if we have enough time.
Okay, well, is there, what, I'm sure Anthony knows this, what would be the process for him to pursue that?
The first thing we'll have him do is meet up with the fire department to make sure the safety aspect of it is taken care of. And then between him and the fire chief, and they can make sure everything else is taken care of. I don't think there's really much left to do after the fire safety part of it's taken care of, but we'll just make sure we're planning before we move forward.
Okay,
Groovy?
as always, yes.
I mean, this is just a basic outline. I'd rather do a more detailed one before I give it to you guys, so.
Yeah, absolutely.
I can leave it if you wanna look at it.
No, that's okay.
Okay,
We'll
cool.
keep it as a surprise, but, yeah. Thank you. Thanks for coming, thanks for saying hello.
Thank you very much.
Anyone else like to speak to matters not on the agenda? Seeing none, we'll move along to agenda item number 13. 13A, it's a public hearing under Resolution 2024-18, Center for Tech and Civic Life Grant, polling places. Notice of this public hearing was made available in the August 28th, 2024 edition of Laconia Daily Sun and posted at Laconia City Hall, Laconia Community Center, Laconia Public Library, and the offices of the SAU. Action on this item may be taken up on unfinished business this evening. I'd like to open up the public hearing at 7:07, and if anyone would like to speak to this, now would be the appropriate time.
Just ask you a quick question. I'm Linda Schmidt. Your comment about the lot that we're interested in on Woodman Avenue.
Hold on one second. So let me close the public hearing. Is anyone going to speak at the public hearing? Seeing none, no one, I'd like to close the public hearing on agenda item 13A at 7:08 PM. Now, Linda, now we're outside that.
Thank you.
That has been moved to the next city council meeting on September 23rd, and it will be on the agenda for a public hearing, so that the public may comment if they have any concerns, questions, reservations, criticisms, just general inquiries about the potential transaction.
So there's no further discussion in this meeting.
There'll be none, no. I called it first because I saw you sitting there, and I wanted to bring it up first so you didn't have to wait till the end. You're welcome. 2 weeks. Okay. Public hearing is closed. All right. Next under agenda item number 14. 14A is introduction to mobile integrated health from our fire chief, Tim Jubert. Welcome.
Thank you for having me, Council, Mayor. Is this ready to go, Glenn? I'm sorry, I haven't. Yeah. Well, in the meantime, if you want to take one and pass it down, that would be great.
Chief, that looks a little like you. This first picture, if someone said that's the chief, I'm like, really? It could be. The rural town doctor.
So I started off in Ashland, and there was a doctor by the name of Dr. Bricker, and he was a town doctor. So we'd go to his office, or he'd come to your house, and that's kind of how it was.
Would you like to share this with anyone else in the audience?
Like, hopefully we can get it up on the monitor.
Katie, do you have an extra one?
I do.
I have one for Counselor Felch. We'll make sure to put it in his box, but you had an extra one. Could you pass it down?
For Counselor Felch?
But if you give one to Counselor Felch, do you have one in addition to that as
I
well?
do.
I'd love to have it.
Counselor Booker, can you pass that down?
Oh, it's not even letting me
So,
open it.
so the program in front of you, and we can kind of work without it if we want, is for a mobile integrated health program, community paramedic. And I don't know if there's another one that I can. Thanks. This is something that's done in other areas of the country, and it's very successful, and it's about getting the proper care to the people that need it in the right place, in the right location. So since I've been here, it's been a goal of mine to try to accomplish this for the city. I think our demographics show that we have a need for it, and we really benefit from it. So we have worked with the Partnership for Public Health. This is all about public health, and a grant was written, a Northern Borders grant, and everything looks really, really promising. Oh, thank you.
You can look at the laptop now.
Yes.
It's funny, I remember doctors coming to the house when I was a kid.
So as I was speaking, we partnered with the Partnership for Public Health, and a grant was written to fund this program for 3 years. And it looks really, really promising that we are going to receive this grant. So I spoke with the city manager and thought it'd be a great idea just to kind of give you an overview of what this program is all about. So as earlier we were discussing, the rural town doctors, they played a huge role in local communities, getting to the people that needed the help where they were located. And this program is very similar to that, utilizing a paramedic that works for the Laconia Fire Department. Demographics in Laconia are pretty unique. You can see that in this graph, almost 1,200 incidents for a 2-year average were part of our high-end users. And an estimated 30% of the time of those high-end users didn't necessarily need a transport to the emergency room. So having this program in place, we will have the ability to work with the other agencies within our community to determine the best course of action for these individuals that need assistance, and hopefully eliminate unnecessary transports to the emergency room. As we all know right now, the healthcare system is overwhelmed, and EMS is no different. In Concord Hospital and other large hospitals, there is a process called stacking calls. There are no beds in the emergency rooms. There's no access, which means that ambulance crews are kind of stuck on the aprons with their patients in the back waiting to get in. And we're very fortunate that this does not happen very often in Laconia, but it does happen, and we've had wait times over 30 minutes on the apron with a patient in the back. Just everybody's really, really busy. So there's nothing more expensive than an ambulance transport and a trip to the emergency room. Your basic life support transport is around $1,300. ALS transport can range from $1,900 to $2,800 with the average ER visit of $2,400. Calling 911, which is important, and getting that ambulance and then the transport to the emergency room is a very, very costly process.
Chief, could you, BLS and ALS, would you?
Yes, I'm sorry, basic life support, so that would be your average medical call, where advanced life support would be more acute,
Okay.
with significant medical needs. So the word integrated is for continuity of care. We really want to work with the other organizations that are in our community to make sure that the people that we're caring for don't fall through the cracks. We also want to make sure there's an elimination of duplication of efforts. A lot of times people are trying to accomplish the same thing because there isn't proper communication. We want to make sure that we have the right care, right place at the right time. And I think if we can do this, we can make a difference in a lot of people's lives. And it's going to be very meaningful. So our target populations, patients diagnosed with chronic conditions, CHF, COPD, our frequent users of ambulance or the emergency department, patients recently discharged from a hospital. When you get discharged from the hospital, you have a grace period, a window, before other social services can kick in. And we'll be working directly with Laconia Hospital in Concord to make sure there's no lapse. So if there's a 4 or 6 day window, our community paramedic can be a part of that to make sure that there's proper continuation of care before those other services kick in as well. Our unsheltered population, we'll be able to work with them at different various locations, and our frail patients who have difficulty leaving their homes. And listed to the right in the box are just some diagnostic things that we can do and some treatments that we can do. And we'll be working underneath the umbrella of Laconia Hospital. So our community paramedic will have a greater scope of skills that they can do working underneath our medical director in the hospital. So some of the roles of our community paramedic that we've already discussed, we can get emergency care, we can go visit Mrs. Smith and treat her as necessary, or we can determine that Mrs. Smith really needs to go to the emergency room to get treatment so she doesn't get delayed care, public education, home safety checks, readmission reduction, social services, prevention, wellness, discharge continuity, and disease management. Kind of just like the rural doctor that used to visit our homes. So primary program outcomes, avoidance of admissions to a hospital or emergency room or nursing facility, reduction in number of missed medical appointments, improvement in medication adherence, reduction in the rate of ambulance transports, successful linkages to social services, patient ability to successfully manage healthcare needs independently after interventions, and cost savings. This grant will fund this program 100% for 3 years. With the goal of cost savings. So the keys to program success, these are all our community partners that we'll be working with. Developing strong partnerships, and that's one of the great things about the city of Laconia, is that we have these already in place. I've already been working, or we have already been working with all these different organizations from day one once we've kind of started discussing this idea. Securing sustainable sources of funding, and the big one will be data collection and tracking. My goal is in 3 years to come before you and show you that we made a difference not only in patient care, but financially as well, so we can continue this program. And the biggest is hiring the right person for this position. This is going to be a unique individual that is out in our community every day making a difference. So that's pretty much the program, just a general vision of what we're trying to accomplish. Again, the funding isn't 100%, but it looks really, really good so far.
Thank you, Chief. I think this is probably one of the more innovative things going on in public health right now, and certainly it's, I would hope that the data you collect over the next 3 years or so gives us some indication whether these investments made at this point in people's lives actually saves money going along a continuum, so they avoid the maybe multiple trips to the ED or repeat visits back into the hospital for more long-term care. I don't want to bias the data, but I'm hoping that shows there's a real fiscal impact on this, particularly for the providers in Concord Hospital, Laconia. Can you talk about that relationship a little bit more right now?
So I have had conversations with our medical director for the last year plus on this program, and our medical director is a huge advocate for it. He knows that there is a need and it can make a difference in our community. I've also spoken to leadership in Concord Hospital throughout this process. You know, my personal opinion is this is part of it, they're part of our community. They need to be involved, and so we're trying to work together to make sure this actually takes place. So,
Thanks. Counselor Cheney.
Thank you, Mr. Mayor. I can't express how heartily I support this idea. At my time at 911, I became aware of, at that time, Concord had a program called Paramedic Intercept. And I asked about it, and I was told, well, it started when we sent an ambulance to the Steeplegate Mall for a woman who passed out. Turns out she was pregnant and just needed a chance to get herself together. At the same time, they had a kid fall off a bike in the south end of the city, scun himself up pretty badly, and I'm sure the firemen in the room will tell you, scratches to the head, bleed profusely without any serious problem. They had one call going that was a true medical emergency. So all three of their ambulances were committed. And then they had a call for a heart attack. And they didn't have an ambulance to send because two of them were tied up on otherwise, you know, not that important. That's poor choice of words. Not as critical calls. The chief and I have had, in fact, I think this chief and the previous chief and I have had conversations about paramedic intercept. He calls it something different. But I'm here to tell the council that what he finds over the next 3 years will not only support this system, but demand that we, or whatever council is here, make it a full part of our fire department. I can't thank the chief enough for bringing this in. I know he's worked long and hard. He and I have had several conversations about it, and he has tried to see to it that he set this up properly, and in the process got the money to do it for 3 years, which I think is commendable. I apologize for prattling on, but I do want to repeat, I am 100% in favor of what the chief is proposing. Thank you, Mr. Mayor.
To agree with Councilor Cheney, I think this is awesome. I mean, really, I think it's the best thing we've done all year so far. But beyond that, just a couple of questions, which, it's a 24-hour service,
to start off with, it would be Monday through Friday during normal business hours.
okay? And then after, okay, is that for the 3 years?
That would be for the first 3 years. Depending on the data, after those 3 years, that could change. A lot has to do with like supply and demand too. It may have to alter based on people's needs and hours of availability. But for right now, the goal is Monday through Friday normal business hours.
This is just for the city?
Correct.
Okay, can you give us an idea what the size of the grant might be? Roughly.
Yeah, if we are successful, which we are pretty confident that we will be, it'll be over $400,000.
Okay, so question there is the grant coming from, where's the grant coming from?
It's a Northern Borders grant that the Partnership for Public Health, we worked with them directly. Partnership for Public Health actually applied for the grant because that's what they do.
That's their thing.
And so pretty much how that would work is they would reimburse us for any costs through that grant.
And if the city, if this worked real well, like I expect that after a year, you're gonna come in and say, here's where I'm at, here's where I'm at, here's where I'm at.
That would be my goal, yes, is
Okay,
to
then
update you on a regular
The
basis.
city wanted to take more further action, or if we saw a need to be longer than 8 hours a day or whatever, we could always do that. But as you said, supply of the care.
Sure.
The caring person, we might say, or the paramedic is gonna be the challenge.
These programs in other parts of the country have kind of blossomed, where not only do they have paramedics, they have nurses, they contract out to other communities, because again, there is a need to reach people at their homes, at
I
their
think it's great.
locations.
I mean, the chart you put together that shows where you're spending a lot of your time doing, okay? Just those incidences on that chart.
Sure.
will more than take care of it. Thank you very much, Chief.
You're welcome.
Thanks, Chief. Go right ahead.
I guess this is towards the city manager. Would that be a separate line on your report you give us, the city update?
Yeah, we could.
You know, so we
Um,
could track and see the amount of calls that it was used
Yeah,
during
I mean, that would be easy to throw,
things
no, that would be easy to add
blossom.
into, what we do, sure.
Thank you.
And this just, if I may, this will be coming back to you, once the actual grant is fully secured for your first hearing, your public hearing and vote. We, Chief and I think you mentioned at the beginning, we just wanted to get sort of that groundwork done so you knew going into the actual grant acceptance, what we were talking about and, hopefully alleviate some of those questions early, so. He'll be back in front of you 2 more times with this, within the next couple of months at the latest.
And my personal goal is if we can get those numbers, get that definitive information, we can encourage other stakeholders to participate as well, like Concord Hospital, Laconia Hospital, and some other organizations, because it's benefiting them as well.
Go ahead, it's okay.
Just make a comment, or did you
I
have a
just
question?
want to ask one more question, okay? The Division of Public Health, the Public Health Group that you're working here in the city, is that the ones that just moved from Water Street down to Academy Square?
Correct.
Okay, thank you. I know some people there, I just want to say thank you.
Thank you for your leadership on this, Chief.
Thank you very much.
Thanks, Chief.
Moving on to agenda item number 15, report. The only thing I'd like to mention to the city and in particular, Laconia Human Relations Committee and Becky Geyer was what a great success the 22nd Laconia Multicultural Festival was. And I was there with Mark and Tony and the parade. And, it's always a special Saturday in September when this event takes place, but it takes an awful lot of work to get it organized, get it off the ground. Counselor Haynes, thank you for bringing along all of the hockey players to assist with the flags. And also thank you to the DPW and your Parks and Rec Department, Kirk, that they did a terrific job in preparing the city for it.
We'll pass
As
that
well
along.
as cleaning it up afterwards, and just a really, really special weekend, as it always is. So thank you to, particularly Becky Geyer. She's a real hero in getting this organized and off the ground. Council comments, number 16.
Mayor, if I could just add, at 3 o'clock, the place was still packed, and it was the end of the day, and it was great. I couldn't believe the number of people that were downtown. It was a great event. And as far as the hockey players, some of them actually carried flags of the countries that they represent, so that's a good thing.
That's great. Yeah. Councilor Cheney.
Thank you,
Councilor
Mr.
Cheney,
Mayor.
were you waving to me, or were you putting up your finger
No.
there? I just saw that come up. If that was intentional or just by chance. It's okay if it was. It's a rough crowd up here. I don't mind.
Called happy coincidences, I think is.
Yeah.
Go right ahead. Now, we want to get Katie Gargano out of here. She's going to be
Yep.
up at 4 a.m., so.
And there's some other ladies in the audience that should go. Mr. Mayor, I have 2 things that I'll bring up under liaison reports, but I did want to bring up a question I received, actually, at the last minute. I received it from a second person. That was a question about what our rules were regarding political signs. Parade Road was loaded with them at Elm Street until 3 or 4 days ago, and they went all away. Our Public Works Department in past years has taken them off of public property, which I think is what the ordinance requires. But I guess what I'm asking is, could the manager report to us next meeting on what the present state of the ordinance is and what, if any, changes he and the Public Works Director might propose to make it consistent.
If I could just throw something, that was not the city that picked those.
oh, I-
No, I'm just making sure that it was
I
not
knew
city.
that, yes,
Okay.
no.
It was.
I
it
was shocked.
It was not city that removed them.
Yep.
But perhaps we can have a conversation at the next meeting.
Yeah, well, I'll bring that up. I just wanted to make sure that was, I didn't know if
knew
we
that.
and I had talked,
No,
but.
no, I knew that.
Okay.
Thank you.
Anything else, Council Cheney?
No, the other two items I have are liaison reports, if I might.
Okay, council comments? Go right ahead.
Just the feedback, that was the DOT on Friday morning that
Yes, sir.
removed them all. And after having a conversation with DOT and all the way up to the commissioner on their timing, it was pulled for maintenance of the road on Route 3 from McIntyre Circle all the way up, and then Parade Road all the way up. So it fell under the Meredith district, so.
It just brought up, we ought to know or be sure that our ordinance, A, is being enforced, and B, is it how we want it enforced, guess was my point.
Okay, well, we want to differentiate between curtilage that's part of our public ways and city public ways and state highways.
And our ordinance immediately references state RSA anyhow, so there's not much of a difference.
Great. Any other council comments?
Just, Bruce, I had the same question that people asked, why, you know,
Yeah.
same thing, so.
All right, how about liaison reports?
If I may, Mr. Mayor. Recently, I spent some time at the fire department, and I hold for you part of the Weirs Fire Station. I found it on the ground behind the building, and I was hoping we could ask the manager to have a professional review the roof and let the council know if that roof needs to be replaced. It looked to me like it does, but I thought we ought to get started on it, particularly with capital improvements working forward.
Is that on our capital improvements list?
It's been discussed, but hasn't been, nothing we've budgeted for.
The second item, if I might, along the same lines, I had the distinct pleasure of visiting the downtown fire station, the main fire station, and was showed the back door to the station, a people door. Go down several steps, you go into that conference room, and I was advised, and to somewhat you can see, that when it rains, that fills in, and then it spills into the fire station. So I'd like to ask that the manager get a quote to put a roof over that walkway sooner rather than later. I don't see any point in us letting the fire station flood out, particularly with the amount of rain we've had of late. But if we could get a price and get it started, as I said, sooner rather than later.
Got them both.
Any other liaison reports or committee reports?
Well, I have one more thing, Mr. Mayor. I didn't want you to get away easy. It's right here. I have this note from the police chief. He and I had a discussion over the weekend with regards to the homeless here in the city parking lot particularly, but in all public spaces. As I'm sure the council knows, the U.S. Supreme Court recently said that cities and towns are entitled to enforce the no camping or loitering on public property. I asked for his statistics on what's been a 3-week enhanced performance effort. They went from August 17th through September 6th at noon. The arrest numbers may climb upon the number of offense numbers which are generated, which may generate warrants. Included in those numbers are 16 drug-related arrests, 21 custodial arrests for criminal trespass, criminal mischief, and 7 theft-related cases. There were 326 extra patrols, 28 ring calls, 53 field interviews, 63 criminal offenses, 47 summonses for city ordinance violations, and what bothered me the most, 35 grams of methamphetamine, 25.5 grams of heroin fentanyl, and 111 grams of cocaine. I wish the council to know that the police department is making an effort to clean up that problem. I know the mayor is working on the homeless issue, but we can't let them overrun our parks and our public parking areas and people's personal property. So the point of my report is to say the police department is making an effort to deal with that problem. And I was frankly shocked with the drug, level of drug confiscation. Thank you.
Thank you, Councilor Cheney. Councilor Hoffman.
Yeah, just a quick update, I guess, on the Electrical Aggregation Committee. We've been meeting with different providers of the electrical aggregation service. I think we're done meeting with different suppliers for that, and I think we'll have a recommendation for the council before too long.
So I think tomorrow, you guys will, if you can agree to it, yep.
Great. Okay, we'll move on to agenda item number 19, which is citizens' request to comment on current agenda items. If there's anyone here in the audience who'd like to speak towards a current agenda item, now would be the appropriate time to step forward. And we'll move right to the city manager's report.
Thank you, Mr. Mayor. In your packet today is the financial and operational trends report. You'll note that the first line there, building construction, is down from the last couple of years. And even when you look at our total number of building inspections later on in this report, you'll see that there's just been a decrease right now. Doesn't mean we're going to stay there. It's just current trending for this point of the year. Fire department stays busy as it shows there, with another few really busy days last month. The next section is normally our welfare, and it is there, but what we've changed, Glenn Smith has changed the layout of this to break it down a little bit more on what you're actually seeing, instead of just saying, hey, this is what we're spending on welfare data, or on welfare. So you see, we now have it broken down by shelter, rent, utilities, burial, transportation, other, with your total expenses down there. So total expense year to date, under gross relief is $39,000 year to date in just our first months. One thing I'd like to make just a point of emphasis on, we don't know exactly how this is going to affect us yet, but I have an inclination that we're going to see these numbers increase next month, because beginning in October, we will be losing any state housing stabilization fund money at the end of September, so for October 1st. That's not all of the state money that goes to housing, but it is I believe there's 3 different pots, and this is one of them, or 3 major pots. This is one of them. For us, we're anticipating somewhere between $8,000 and $9,000 a month in increased welfare requests coming through that just this program affects. So there's an opportunity that doesn't all come in and downshift to us, but there's also that opportunity that it may, and we'll have those numbers. So we will track that for next month. You'll see this break out a little bit differently, or in this new format, and we'll note if there's any differences with that program going away.
Just a quick question here, maybe Glenn or you both know the answer to this. Why the drop-off in stabilization funding?
They've said it's run out of money.
That's it, so this
That's
is,
what they told us that's what they told us,
correct.
yeah.
was this sourced out of state funds or out of ARPA funding?
I don't believe it was ARPA funding. It came to us through the state. Whether they were channeling federal funds or not, we're not sure. It's heretofore been a state-run program that we are not directly involved in. They have just let us know that they have run out of money and will be discontinuing services. Just occurs to me as I sit here that the timing of that might lead me to believe that's federal money only because of September 30th, October 1st deadline.
Thank you.
Next page, police department activity, they continue to stay busy. When you look at how they correspond with previous years, they're consistently up. But you also heard the report from Councilor Cheney on some increased patrols that they've been doing this month. Property tax collection, a little under where we normally are at this time, but nothing surprising there. Overtime, we're in the same position. Most departments are staying right in line. Again, I sound like a broken record, but as we increase our staffing, which we're doing, the amount of overtime does decrease, and we're seeing that trend. It's continuing, and it continues to work. Motor vehicle registration on the next page is a little bit ahead of where we would expect to be at this time, which is good. Parks and recreation facility use is up. They had a busy last couple of months. Impact fees are no real changes to that. Impact fees, we're gonna talk about that, I think, a little bit later in another agenda item. No real changes, again, in the reserve fund balances, pretty much straight through the rest of the report. I'll work with the fire chief on the last page. We should have had a couple of changes in the billing numbers from at least through June on here, so I think on the EMS billing report, it's lower than I would expect it to be. And it could be a timing thing. Sometimes when we have an earlier monthly meeting, the billing company hasn't got all the updates to us yet that we need, so we'll get that updated, and if I have to do 2 months at the next point, I will.
Any questions for the city manager?
Just one quick one there. Kirk, are the beaches closed? I mean, my question
Yes.
is that
Yes.
there was some comments about maintenance at the beaches, and was assuming that, which I know is a dangerous word, but that they were closed after Labor Day.
Yes, and the carry-in, carry-out that we started last year continued to make a difference. And I will speak to benefit the Parks and Rec Department. The community beach workers that they have up there, some are college students, some are other people. I went up there and watched them for an afternoon work, and they struggled to keep up with the crew up there. But yes, so they are as of right now closed.
Oh,
Yep.
okay. Thank you, Mayor.
You're welcome. Kirk, quick question in regards to the graffiti that on the buildings in the downtown district. Where are we in regards to getting bids to clean and sign-offs from property owners?
The company did finally get back to us. Just today, they asked me to go out and walk with them, so I have to do that. So I don't have an update on the cost or what it'll take to be able to work with the individual
Any feedback from
businesses.
property owners that have been made aware of this and whether they're willing to sign off on?
I've had at least one say they worry about what we're gonna do to clean it, because they worry about the integrity of the bricks. So that would be a potential concern that they had. Otherwise, I haven't had a whole lot of feedback.
All right, thank you. We're gonna move on to new business right now, under agenda item number 21. 21A, Resolution 2024-19, request to accept and expend a grant on behalf of the city in an amount up to $25,000 for substance abuse reduction activities for the Laconia Police Department. Kirk, could you walk us through that? I don't see anybody from the PD here.
Yeah, this is a grant that they get every year. It allows them to do increased patrols for substance misuse, drug, essentially, extra patrols for drug searches to go around and if they see drug activity, that type of work. And it's a recurring grant, and looking to just get it approved again this year.
Thank you. Right now, I'd be looking for a motion to approve Resolution 2024-19 relative to accepting and expending a grant on behalf of the city in the amount up to $25,000 for substance abuse reduction activities for the Laconia Police Department as presented, and to authorize the city manager to sign all documents related to this grant. So made by Councilor Cheney, seconded by Councilor Haynes. Is there any further discussion on this? Seeing none, all those in favor, please indicate by raising your hands. That's 5 votes in the affirmative, and that motion passes. Next, agenda item number 21B, request for discussion on implementing a community service recognition award. Councilor Haynes, be happy to have you lead this.
Oh, thank you. Just a little bit of background. During the process of the B&R's award, I was on that committee, and it just came to me that, and I've spoken to a number of people that I've had a chance to, that we really don't recognize the time and talent of the people that we ask to serve on our regular boards and even in our community. So I did a little research, and, you know, a lot of communities, even small towns, have a community service award, and I just came to the conclusion it would be worth to have a conversation and see if the council thinks that this is an idea we should move on. And if you notice, there's no criteria with it, because I thought that if you would appoint a committee, Mayor, that we could look into it and craft something that's our own, and just not something that we mimic something else. So I think it speaks for itself, and I'd like to hear from the other councilors if this is an idea that's worth pursuing, and if it is, if you would appoint a committee.
Not only that, I'm going to make you the chair. If I can. I don't know if I can.
Well, I want to
but-
hear from the other council.
Okay. All right, well, I want to let them know they can speak freely, because they're not going to have an, anyway. Other councilors like to speak to this. Councilor Susie.
I think it's a fantastic idea. I think it's a fantastic idea. I want to hear, and I guess I go to the committee annually, quarterly, whatever way you do it, yearly, whatever else like that. But I think, and these are, we're talking about everybody, including city employees and.
No, I would like to keep it to people that's
Citizens.
volunteers and people within the community. I mean, as long as they're not on the payroll. But that's up to the committee. If they would, if they would like to do something like that, that's fine. You know,
I think it's
I just
great.
thought that would be something that the council could craft that would be our own.
Right. No, I think that's really good. In fact, you brought one up earlier with Becky, what she did for the multicultural and stuff like that, so I think it's good.
It's just a number of, Bob, my feeling is there's a number of citizens out there that are more than
Hey,
due to be recognized for their services to the city.
right, and I think most people would say, I remember I learned it in school real quick, warm fuzzies are better than cold pricklies.
Right.
In regard to what?
Warm fuzzies, not the back,
Oh,
instead of being
oh, oh.
ignored.
So, Mayor, does that mean that Tony's on the committee because he's not here?
I'll make him the secretary, so just keep notes. Anyone
I
else
will
like to
say
speak?
that, if I can add, I spoke to the city manager about this, and Nancy Brown overheard the conversation, and I asked the city manager if Nancy could work with the committee, and he said very positively yes. And she agreed to work with the committee to come up with something that we can present back to you, I would like before the holidays, so that the entire council can see the criteria and what we'd like to accomplish, and come back and, you know, present it to the council.
So I would recommend that this council consider appointing 2 councilors, Haynes and Felch, to this committee right now, and work with the city manager to round out that committee with people from the city that have a lot of contact with the public, who maybe
Okay.
bring attention to people who go above and beyond. And I would think, I would recommend Katie Gargano if she were available to do this. I'd recommend Amy Lovisic if she were available to do this.
Okay.
I'd start there, but I think these are some people that come in contact with a lot of the public. Maybe we can just have a follow-up at the next meeting as to the general parameters of the makeup of the committee. And maybe if anyone has gotten back to you and said they'd like to join, then maybe we
Sure.
could make a more formal motion to create this committee. How's that?
That's fine. I have one other request. I've given a lot of thought, and I've talked to some of the other councilors. I'd like to ask, seeing as we're going to pursue this, that by unanimous consent, that the award be named the Bob Hamill Community Service Award for the recognition of his service that went far and beyond that of a city councilor. So I ask for unanimous consent.
So, yeah, either you'd have it for me. I mean, I anticipate that it'd come around right around here, so.
Okay.
We could do that, and that'll be the name of the committee. Maybe we could just work over the next couple of weeks to
You get that done?
build it out. That would be just terrific. Thank you,
Thank you,
Counselor
Mayor.
Vance.
I appreciate it.
Appreciate your leadership on that. All right, agenda item number 21C, request to use American Rescue Plan Act ARPA funds to replace the failing apparatus bay door systems at the Laconia Fire Department at Weir Station. The fire chief has indicated the need for $15,000 of ARPA funding in order to replace this failing apparatus door system. If done so, the proposed expenditure is, if it's approved, it will increase the reliability and safety at the Weirs Fire Station, particularly with regards to the apparatus bay doors, which, as we know from earlier comments, the Weirs Station may need a little TLC. So right now, I'd be looking for a motion to move to use the previously accepted ARPA, American Rescue Plan Act funds in the amount of $15,000 to replace the failing apparatus bay door systems at the Laconia Fire Department Weirs Station. So made by Councilor Cheney, seconded by Councilor Susie. Is there any further discussion? Seeing none, all those in favor, please indicate by raising your hands. That's 6 votes in the affirmative, and that motion passes. Agenda item number 21D, Councilor Cheney has requested a review of the City of Laconia noise ordinance located at Chapter 167 of the City Codes. A copy of the current noise ordinance is attached. I would suggest, and I would agree with the city manager, that this item be referred to the Government Operations and Ordinances Committee. Do we need a vote, or does everyone agree to do that? Are you satisfied with that, Councilor Cheney?
I am, absolutely.
Okay, so I'd like to move that to the Government Operations and Ordinances Committee. Under unfinished business, agenda item 22A, and this is in regards to Resolution 2024-18, request to authorize acceptance of the Center for Tech and Civic Life Grant in the amount of $20,000 to fund the purchase of equipment to facilitate secure and efficient operations of Laconia polling places. Kirk, would you, or Katie, would you like to talk about this at all?
I don't know what you'd like me to say.
Same, is this the same we talked about in the last meeting?
Yes.
It is.
Yep.
How did it come, why did it come back? We didn't put it on, we didn't,
There's a public
We had a
hearing
public
tonight.
hearing earlier.
okay, that was it though, right?
Yep.
Okay, we're ready to roll. Anything else you'd like to add to this, Katie?
Nope, just looking forward to seeing it pass.
Okay. Looking for a series of 3 motions right now. The first is to waive a reading of Resolution 2024-18 in its entirety and to read by title only, so made by Councilor Cheney, seconded by Councilor Haynes. Is there any further discussion? Seeing none, all those in favor, please indicate by raising your hands. It's 5 votes in the affirmative. That motion passes. Next, we're looking for a motion to move a second reading of Resolution 2024-18 relative to the Center for Tech and Civic Life Grant in the amount of $20,000 to purchase equipment to facilitate secure and efficient operations of Laconia polling places. So made by Councilor Haynes, seconded by Councilor Hoffman. Is there any further discussion? Seeing none, all those in favor, please indicate by raising your hands. That's 5 votes in the affirmative. That motion passes. Finally, on this matter, looking for a motion to move to approve Resolution 2024-18 relative to Center for Tech and Civic Life Grant in the amount of $20,000 to purchase equipment to facilitate secure and efficient operations of Laconia polling places, and to authorize the city manager to sign all documents related to this grant. So made by Councilor Susie, seconded by Councilor Hoffman. Is there any further discussion? Seeing none, all those in favor, please indicate by raising your hands. It's 5 votes in the affirmative, and that motion passes as well. Moving on to agenda item number 22B. Proposal to change the city council's 2019 guidance on the Accept As Is program. If I'm not mistaken, this is
It's on the table.
on the table. So I think before we go any further here, we'll be looking to take this off the table first, and if so, there's a motion to take it off the table by Councilor Cheney, seconded by Councilor Susie. I'd ask clerk to call the roll.
Counselor Cheney?
Yes.
Counselor Susie?
Yes.
Counselor Hoffman?
Yes.
Counselor Haynes?
Yes.
Counselor Bogart?
Yes.
5 votes in the affirmative, and that motion passes. This item is now off the table. Who would like to lead in the discussion?
I can start by just, this was guidance to this, in 2019, the council at the time gave guidance to the city, Public Works, the manager at the time, that if we were gonna proceed with an accept-as-is road, making a road private to public through the accept-as-is program, not any of the other programs that we could discuss to do that with, that it had to have 100% of abutters, and we accept that as approve it before we move forward. There was a question about owner or butter. We took the language out of the state and corrected it that way with the word butter. We just took it from the state RSAs. What we've run into is on a couple of occasions, you may have one person on the street say, no, I don't want to do it. You don't have your 100% guidance. And for us, we really, for lack of better terminology, we basically stopped moving forward with the process at that time unless we can work to get 100% approval. We have a couple of streets right now that we're working on where we have, if you did the math out, upper 90% of acceptance, but you have 1 or 2 people that are saying no. This would give the guidance to us that we can continue to move forward, bringing it to you. It does not mean that less than 100% is an automatic, we're gonna approve it. What it means is with less than 100% of abutters saying yes, we can still move forward with the process and get it in front of you for the public hearing and votes and all that. So, it's hard to come forward with that guidance when we don't meet all of your previous requirements. So this way, if we have a majority, that allows us to bring it forward and puts it back, the onus back onto this council to say yes or no to approving whether we accept a road as public or not.
Didn't it come up at the last meeting and it was requested, we talked about that, because if you didn't have 100, you couldn't even move, you were dead.
Correct. That's there was some language that you wanted it tabled for last time. We adjusted that language, but yes, that's what it is. We really don't have the opportunity to move forward to get it in front of you officially if we didn't have the 100%.
Okay, and I think it was suggested from Wes and also the planning director to move forward, something like this.
Yeah, we had our attorney in, I don't know if I've talked to the planning director a lot about it, but I think this allows us the opportunity to get it in front of you on a broader scope as opposed to being locked into, it has to be perfect before we bring it forward.
Thank you.
Yeah, I think as we deal with these kind of road by road, each one is so vastly different. We got to give ourselves the leeway in order to kind of deal with each case on the merits of that case and not be kind of locked into these requirements. I'm sure they made sense at the time, but I think we're finding it pretty restrictive.
Did anybody look back at the discussion of the council when these were put into effect or not?
Wes may have it, I don't have that.
The council at the time had a lot of discussion on it, and it basically led to the point they wanted 100% to minimize any disagreement with the property owners about proceeding forward with it. But we're finding out that it's very difficult to get 100%. So that's why we came back to say, okay, do you want to change your guidance or not?
Okay, thank you, Wes. So there is a proposed motion here. Is it council's fancy to move the motion?
Please.
All right, so looking for a motion right now to move that the city council approve changing guidance from 100% to a majority of abutting owners, looking for a motion to move that the city council approve changing the guidance from 100% to a majority of abutting landowners provide. That should be, I think, must provide. That's what's, I think am I reading that incorrectly, or am I just having a moment? Move the city council approve changing the guidance from 100% to a majority of abutting landowners provide an easement for an eligible private road accepted under the accept as is program. There's something that's grammatically off there that doesn't. To a majority of abutting landowners, that something in there must provide, in order to provide. It's just not, it's gotta be cleaned up.
It doesn't flow very well.
No, there's something at least grammatically awkward, if not downright confusing.
Required to provide, something like that.
So, the majority of
Superintendent, were you an English teacher or were you?
To provide an easement. Landowners
Changing
to,
the 100%. To a majority of abutting landowners.
or you could say, which would provide an easement.
Should we, Mr. Mayor, there's no doubt this is gonna come up for a lot of discussion. Should we send this, ask the city manager, bring to legal, ask legal to write?
Yeah, we're gonna do.
I don't think we need
to.
legal.
I don't think we
it's
need to. I
eighth
think we
grade
just
English
need to.
English class right now that's got me all twisted up. I don't know if a lawyer would actually make it better, quite frankly.
We have one looking at it right now.
I don't disagree.
We have one looking at it.
Quick, I think that needs to be redrafted and made very simpler, because I think if whatever we pass right now, it's going to make it, I understand, we all understand what we want to do, but it needs to reflect our intent, and I'm not quite sure this does. This makes it just confusing.
It's not
It's
gonna
almost
hurt.
two separate phrases there.
It's
We're going to approve changing guidance from 100% to a majority of budding landowners in order for an easement for an eligible private road to be accepted under the accept as is program. I'm trying to make this more challenging, but I just think it's messy.
Yep, no, that's fine. We can do that.
Send it back to the wordsmiths.
It won't hurt. In a couple more weeks.
Yeah, I don't think it's gonna hurt. All right, so.
Do we have to table it?
I guess we gotta put it back on the table and with the intent to bring it back on the 23rd.
Table.
Motion to table by Counselor Susie. Is there a second? Counselor Bogart? Please call the roll. Not a big roll.
Counselor Cheney?
Yes?
Counselor Susie?
Yes.
Counselor Hoffman?
Yes.
Counselor Haynes?
Yes.
Counselor Bogart?
Yes.
Items tabled. D. Oh, we did 22D, all right. Moving on to agenda number 22C. Request for funding for the Elm Street Schools Traffic Plan Study. Kirk, would you be so kind as to lead us on that?
Yep, so this was, as we've talked about on a number of occasions, there's concern over the traffic at on Elm Street, at Elm Street School during pickup in the afternoon. We have put out a request to hire a company to do a traffic study and also come up with alternative traffic solutions, including whether, and what we told them was, we're not looking, we don't want to stand here and say, what would it cost to do X? We wanted them to have, an opportunity as the traffic specialist to look at a variety of options. Some would probably be an exorbitant cost, and some may be very simple that they could come up with. So we're having them look at if widening the lanes for the drivers picking up the children, the access road that we've talked about quite a bit, going out to Bond Beach Road, and then also an opportunity for the driveway to essentially wrap around the school, the pickup queue line to wrap around the school, and maybe even add some parking out back if it takes up parking spots from the school. For them to do their study, they all put in a bid. The bid was evaluated by DPW and the SAU, and the winning bidder, if it gets approved, came in at $63,660 to do the study. There's a request on here, and Superintendent Champlin is here as well. There's a request on here to use the ARPA funds, but our suggestion that we came out with today is also going to be to tap into impact fees, so the whole amount doesn't come out of the ARPA fund money if you approve this project. And we didn't really discuss the total amount, but before I dipped into his money, I'd let him speak on that.
So the total estimate to do the job is $63,660.
That's just to do the study, yes.
That's just to do the study. So we're going to rely on what pot of money for funds to pay for that?
A combination of impact fees and ARPA money.
Okay, all right. And this is
The percentage of each, well, like I said, we can have that discussion.
And this is satisfactory with you and the superintendent and?
Yep.
Good.
I am.
Yeah, come on up. First and foremost, it's nice to see you and welcome back to the SAU.
Well, thank you. It's a great place to be. I live here, and I have a family, so it's very cool. And if there's a Bob Hamill Award, that's an amazing thing. He used to say, it's for the kids. That was the thing he would always say, I think. So we did have a conversation, and I think we are fully supportive. And at the same time, I am in interim for about 5 minutes here, and we have a school board. So I would want to bring it to the school board. I had a conversation, we've already talked about it conceptually, and I had a conversation with the Budget and Personnel Chair about impact fees today. We used $100,000 in impact fees to do the back of Pleasant Street to set up the new playground. And I hope that, I know you guys have toured Laconia High School. I hope you could take a look at those playgrounds. If you're going back of Pleasant, Woodland, and Elm, all ADA accessible, all kinds of things. So we think that impact fees is a good way to do something like this. And so conceptually, all in with the city manager, and at the same time, 7 people sort of tell me what to do. So I need to bring it to them.
Okay, great, thank you.
All good?
So right now, looking for a motion to move that the city council approve using uncommitted ARPA funds and impact fund, well, we wouldn't be, and impact fees?
Fees, yep.
And impact fees to fund the cost of the traffic study for Elm Street School. So made by Counselor Hoffman, seconded by Counselor Susie. Is there any further discussion? Counselor Cheney.
I just think we have similar issues. I'm not sure about Woodland Heights, but I think at Pleasant Street School as well, there are traffic issues at certain times of day. I think it's just a concern when it's 20 minutes of cars just sitting in the street and you can't get through. I don't think it's as severe as Elm Street. So, maybe once this study's gone through, we might want to take a look at, make sure the same issue isn't happening at the other schools.
Counselor Cheney.
I would like to recommend that we amend the motion to suggest a 60-40 split. 60% funds, impact funds, and 40% ARPA funds, or any other 75-25, whatever the council might choose. But I thought we ought to include that so that when he goes to the school board, he's got a number.
So, the impact fees, correct me if I'm wrong, does the city council have discretion on how to use impact fees, or is that the SAU? And the ARPA fund, I'm sorry, go right ahead.
That'd be city council.
And then the ARPA fund, that's SAU money, isn't it? Not our money. That's all of our money?
That's our ARPA money, the city's.
Is there any particular reason we would split it or not fund it from one pot of money?
The ARPA fund money is, I don't have enough in the ARPA fund remaining money to cover it. That was the reason that we looked at both pots of money.
Okay, and the ARPA money must be spent by the end of '26.
Right.
This will be.
And I'm almost, we're getting close on wrapping it up anyhow.
So how much do you have in that fund?
I have 60,000 in the ARPA fund money. We just took 15 out.
So you have 45 now?
Yep.
So would a recommendation to spend the balance of $45,000 of ARPA funding and then the 18,330 out of impact fees or not? I mean, it's gonna leave us with if we don't spend every dime of it, it's gonna leave us with a negligible amount of money in the ARPA funding.
It would work for me, it's up to you guys.
Okay,
But if I might, Mr. Mayor,
Yeah.
we were just tonight talking about a couple of projects at the fire department, which ARPA funds could be used for. So if we could keep some ARPA funds to do those projects, it would
Okay.
make sense to me. Because there's 60-some odd thousand in the impact fees.
okay.
So, you know.
Okay, so your motion, so you're offering a friendly amendment to this to split the allocation, 60 impact fees, 40% ARPA.
Correct.
Who made the motion? You
I did, and I'll accept the friendly
Okay.
waiver, no.
So, it's a friendly
Amendment.
amendment, and you agree with it? Who seconded it? Counselor Hoffman? Okay with it?
Yep.
All right. Katie, do you have that for the record?
Split the funds, 60/40, 60 impact fees, 40% ARPA funds.
Yes.
Thank you, Mr. Mayor.
All right, any further discussion on the motion, the amended motion? Seeing none, all those in favor, please indicate by raising your hands. That's 5 votes in the affirmative, and that motion passes. Okay, that makes sense, good sense. Thank you. Thank you. I'd like to, there's no reason for us to go into non-public session this evening, so I'd like to adjourn this meeting at 8:12 PM. September 9th, 2024.
Done with this?